natural, but that doesn't mean it's going to come easy. Today we're going to be discussing the basics of breastfeeding. My name's Jamie, I'm a midwife, I've been attending births for over a decade. Why some women choose to breastfeed and some people choose not to is a personal choice for many people. For some it's convenience, for some it's cost, for some it's bonding with the baby. Whatever the reason, we're here to talk about what to expect to get you started on the right foot. Breastfeeding is a supply and demand system, and in the first couple weeks there's some really important things to keep in mind. The first couple days, your body is going to produce colostrum, and it is a very nutrient-dense, thick substance that only comes in small drops. Don't expect the milk to be flowing, and that little amount is exactly what your baby needs. The first day the baby is born, their stomach is the size of a marble. It's tiny. By day 3, it stretches to the size of a ping pong ball, and by 1 week to 2 weeks, it is the size of an egg. So that is really helpful to keep in mind when you're freaking out that you only are seeing a couple drops, they're not getting much. It's okay. That's actually how it's supposed to go. And the more you nurse your baby, the more your body is understanding that it needs to start making milk. For most people who have had a straightforward delivery, that can be expected usually around day 3 to 4. Now, if you've had a C-section or you bled more than expected at birth, sometimes it can take a little bit longer for milk to come in. It's important that you try to latch the baby within the first hour of birth. Your body has all these hormone receptors that the placenta has been making and sending out hormones to your body throughout your entire pregnancy. Once the placenta has left the body, there are these open receptors that are waiting for this new signal from the breast to start producing breast milk. So in the first hour is that time frame to do that. If for whatever reason the baby cannot latch in the first hour because maybe they're tired, maybe you just can't get them to latch, maybe they've gone to the NICU, for whatever reason, if you're unable to latch in the first hour, it's really important to hand express so that your body knows it's time to start thinking about making milk. This can affect your supply later on. So how often should babies be nursing? Babies typically nurse every 2 to 3 hours. Something to think about is how you like to eat. Do you eat on a rigorous schedule? Are you eating every 2 hours the same amount of food? No, and babies are the same. Babies are not going to eat on a consistent schedule or even for the same amount each time. Think about it this way. Sometimes you want a meal, sometimes you want a snack. Sometimes you just want to graze for hours. Babies are the same. Sometimes they want to cluster feed for 2 hours. Sometimes they'll go 3 hours and take a long nap. Sometimes they're eating every hour on the hour. All of this is normal. It's helpful to understand that the baby is listening to its hunger cues versus expecting them to be on a vigorous schedule. Immediately after birth, the baby will be wide awake and alert for the first hour or two. It's great to take advantage of this time when they are alert. It's not uncommon to have a helpful nurse around who is willing to offer some support and some pillows and direction, so definitely utilize that. Then the babies will take a long stretch of sleep because they're exhausted. Birth is hard on them, right? As exhausted as you are, their day just got really weird too, and it's not unusual for them to be really sleepy the first day. So if they're having a hard time latching the first couple hours, even the first day, don't be surprised or discouraged. That is totally normal, and you've got time to work it out. Whether it's your first baby or your 10th baby, this baby has never nursed, and it can take up to 6 weeks to establish a good breastfeeding relationship. So we've discussed the first couple days, the milk hasn't come in, and babies may suck and nurse often. Then, as your milk starts to come in, you may realize that they come off the breast quicker because they are more full and satisfied quicker. Or maybe they're nursing more often because they're hungry and they want to bulk up. Giving yourself time to work out what works best for you and your baby and keeping realistic expectations is going to go a long way for duration of breastfeeding long term. The most important thing with nursing is a good latch, right? The things to keep in mind when nursing a baby is you want to put them tummy to tummy, their tummy towards your tummy. You don't want to put them tummy up. You don't want to make them have to turn to work towards the breast, right? So tummy to tummy, hold them at the nape of the neck. A common mistake I see parents making is holding the head and forcing the baby to the breast. Now, the baby is just going to get frustrated. They're going to feel like they're being pressured to do something they don't want to do versus helping them do something they actually want to do. So for the initial latch, hold the baby by the nape of the neck, point the nipple at their nose, and you'll notice the baby tip their head back, open up wide, and get a good latch. You want the entire nipple and areola to be in the baby's mouth. A shallow latch is gonna cause nipple pain for you and not gonna be fun because also the baby is more likely to swallow air when that happens. So if the baby has a shallow latch, you wanna break them off. Do not pull the baby off because that suction will hurt your nipple. What you're gonna do is put your pinky in the corner of their mouth to break the seal and remove them and try to latch again. So once they have a good deep latch, then you can switch, put your arm to hold their head back, whatnot. Of course, there are various positions that you can try. The thing is, if you try a position once and the baby doesn't like it, don't be discouraged. Try it again a couple times. It may take some practice on both of your ends to master each position, and some babies have ones they prefer over others. A lot of hospitals nowadays provide a lactation consultant. You may not see them the first day, but generally you will see them within a 24-hour period at the hospital. Babies are expected to lose weight in the first days of birth, and they are expected to regain it by about a week to 2 weeks postpartum. So a problem arises when we're looking at the weight of the baby and it seems like they've dramatically dropped a lot of weight, and then of course parents or hospital providers are concerned, okay, the baby lost too much weight, we have to supplement. 10% or more of body weight is concerning. During these times, it's not uncommon for people to recommend formula. The problem is, if you're feeding a baby formula versus putting the baby on the breast, the body is not getting the signal that that baby needs to eat as frequently as it does. So it can cause problems with making enough milk to support this baby and affect supply later on. If your provider feels it's best to supplement your baby for whatever reason, latch the baby first, let them nurse, and then top the baby off with a bottle so the body is getting the memo that the baby wants to eat. Now, in addition to weight gain and frequency, another reason that a provider may encourage supplemental feeding is jaundice. Because if a baby is developing jaundice, sometimes around day 2 or 3, more frequent feedings do help flush that out. So that may be a good reason to supplement your baby with additional formula. So some of my tips for successful nursing relationship. Stay skin to skin with that baby early on, the first couple weeks. Keep that baby on your chest. Look for early hunger signs, which can be turning of the head, licking the lips, turning towards their hands and putting them towards their mouth. This is the ideal time to start putting the baby to the breast versus when they're crying and frustrated and starving, because they're going to be less cooperative then. Breastfeeding takes practice. Be patient on yourself and your baby, and don't hesitate to reach out for additional support.